All right, welcome back to Survive Outdoors. If you don't know what we do wilderness medicine videos to try to keep you safe in the outdoors. And if you get injured, what you should do in order to get back to base camp safely or home or your vehicle. I'm a licensed PA. I've been practicing medicine for about 43 years in urgent care medicine. And the other day, I have this lady come in that smashed her thumb in the car door. I'm like, why haven't I done a video on this? Because it happens frequently in the outdoors. I get people that come in, they drop a log at a campfire on their finger or on their toe, and I haven't discussed on what to do with that and some tricks of the trade. So what I did is you'll see her fingernail here, and you'll see it's the blood underneath the nail. That's called a subungual hematoma, blood under the nail. And I x-rayed it, and there was no fracture. You'll see the x-ray here. It's perfect. And then what we did is it's called trepanation, where we take something hot and I took a cautery, a bovie, and put a hole in her nail, as you'll see here in the video. Ready? All right, here we go. On the count of three. 1, 2, 3. I'm going to push. How you feeling right now besides wanting to hit me?
That's pain.
Okay. The video, and it lasts 1 second and we're done. And she'll do fine. But there's some things you should know about that. I mean, I have construction workers that do this all the time, and they'll take a drill and run a bit through their fingernail. When back in the day, what we would do, we're talking like 1980, 81, we would have a Bunsen burner. And then what we would do with the Bunsen burner is heat a paper clip and put a hole in the nail, and it relieves the pain tremendously. It really helps a lot. So you can take your camp stove, you're out there in the outdoors, and you can basically light this puppy up. It'd be nice if I turn the gas on, right? Wow, there we go. And you can take a paper clip, you can take a pin, and you can heat that over the flame like that till it gets red hot, and you can run that through your nail. Now, you're going to read, probably if you Google this, that some individuals advise you to rotate the pin or the paper clip and have that motion going as you don't need to do that. If this is hot enough, it will go right. It's 1 second and just melts the nail, and out comes the blood. And immediate relief of pain. It really is, prolific in terms of pain being totally absent after all that pressure is released. A few things I want to discuss, though, is that it used to be thought that if the blood was underneath the nail, about 75% of the nail, that would indicate a very high chance of a fracture. Not true. There's no evidence of that at all. Then it was also thought that if you had you put a hole in the nail and you have busted your nail bed, that's why the blood basically bleeds under that nail. And if you have a fracture, you should prophylactically give someone antibiotics, because it's very similar to an open fracture. An open fracture is, there is no difference between a bone sticking out of your arm and getting infected, or having a busted nail and you have a break in the skin, and that bone can be subject to infection, hence osteomyelitis. Scouring the research, that has basically it's theory. There is no evidence that you're going to increase your risk. However, I still give about, if there's a fracture in the bone, I still give people about 7 days of an antibiotic. If there's a, and it all depends on the severity. I mean, if it's a massive fracture, they're going to get 2 weeks. And then in some situations, we'll actually take the nail off and sew the nail bed up, put the nail back on as a protective shield. For you guys in the outdoors, if you drop a log on your toe, on your finger, what you're going to do is basically splint. You're going to put the whole nail. If you're 3 to 4 days from getting back, totally fine to put the hole in the nail. I'm here to tell you, if that blood is under that nail and you have gone on for about 2 to 3 days, on the third day, I don't put a hole through these nails because that blood is going to coagulate and you're not going to get that release. So it's pretty well worthless at that point. This is why it's important to discuss this for the outdoors. If you're out there for 7 days and you can't get back, you can go ahead and try putting that hole through the nail. And here's the trick. I mean, one of the things about splinting this, you can get your SAM splint material, measure you off a piece of the SAM splint, cut you a piece off for a splint. And we're going to be giving away in March, one of the prizes is going to be a SAM splint. So when you measure that off, or you can even use bark on a tree, and when you splint that, you're going to splint your finger down here past this other joint, and you're going to splint it about 1/4 to 1/2 inch past that fingertip, right? So what, dropped it. You're going to wrap your Medi-Rip around and splint that finger. The reason why, if you've ever gone fishing, you know you're going to get, a lot of times that line's going to get caught on something. The same thing with this. You injure a finger, you know darn well, if you splint this sucker like this, you're going to bang this finger into something. It's Murphy's Law. It's going to happen. So what I advise people to do is splint it, give yourself some room with bark or SAM splint or whatever you're splinting your finger with. That way, if you're going to bang your finger, you're going to hit this splint and not the wound, and they're not going to hear you cuss from here to California. So that's going to be really helpful for splinting. And I also advise to get an x-ray. Really important, because you don't know if it's fractured. But by rule of thumb, no pun intended, if that blood is 50% or less, very unlikely you fractured that distal bone called the distal phalanx. This is how you put a hole in the nail. A lot of you probably already knew that, but hopefully the splinting was a new technique for you guys. All right, keep your eyes on the horizon, your face to the wind. Until next time.